Hi, hello everybody. Welcome to this team meeting. My name is Elizabeth Bonilla and I am the case manager for the school district. So I would like to start this meeting by going around the table and introducing ourselves, and then we can get started from there.
I am Casey Cantrell and I am a school speech language pathologist.
I'm Ellie Garner and I'm also a school speech language pathologist.
I'm Haley Scopenet and I'm the school audiologist.
Okay, sounds good. Thank you all for coming today. Today I would like to primarily discuss one of our patients, Christina Smith. Christina Smith is a 5-year-old, 4-month kindergarten student in our school. And I talked to Miss Smith, Christina's mother, about her background history. And I would like to give you an overview of that, and then we can go into the audiological evaluation and then into the speech evaluation from you both. So first, I would like to say that Christina was adopted at 2 days old, according to Miss Smith, and according to the attending physician and Miss Smith, who saw Christina like 3 hours after she was born. Christina looked to be a healthy baby. She started her first words at 1 year. She sat at 7 months, and then she began walking at 14 months. And to me, I think that is following a typical developmental pattern. So nothing to be concerned there. She spent at home. She has 2 brothers who are also adopted. And Christina's ethnicity is Native American. Whether or not Miss Smith has immersed Christina into that culture, I'm not really sure. I didn't get that information from her, but I think it's something that we need to be aware of moving forward. Christina's mother is a single parent and she's often away from home. Christina spends most of her time with her French governess, who is often speaking French to the children at home. And so I just think that that's also something that we need to be aware of when we were doing the audiological evaluation and the speech evaluation. So Casey, I was hoping you could tell us a little bit more about the speech evaluation.
Absolutely. So Christina was referred by Dr. Ron Dangerwell, and he referred her from Hollywood General Hospital because of results from her hearing screening and concerns about her articulation. So we assessed her articulation, her intelligibility, and her hearing abilities, which Dr. Scribner did, or is going to talk more about. And from the language sample we collected on her, we found that she had an age-appropriate MLU. Her story retell of The Frog, Where Are You? Was good, and it included a variety of details and outcomes. She used a variety of pronouns, verbs, and morphological markers. She did have overgeneralization of the past tense marker. She said stuck and falled, but this could be a emerging skill for her. So her articulation assessment revealed 3 different phonological processes that she was producing: the palato-alveolar fronting in the initial and the final position. She said SARP instead of sharp, bids instead of bridge, and watts instead of watch. She had stopping of affricates in the initial position, so this was presented as tear instead of chair, and dam instead of jam. And then she had initial cluster reduction, and she said pane instead of plane, and cab instead of crab. So from the information we collected, we determined that she has a mild to moderate articulation and phonological impairment, which is characterized by the palato-alveolar fronting, stopping of affricates in the initial position, and initial cluster reduction. But Dr. Scribner, had some information about the French language and how that could be an influencing component.
With her French background, I know that within the French language, I've taken French for 4 years, and for the L sound in French, or in English, it tends to be elongated, and in French it's not as elongated. So like for the word plane, she might not be elongating the L on purpose because of the French background that she has, so that's something to consider.
Okay, that's really good to know, because I know that Miss Smith, Christina's mother, was telling me that that Christina she finds Christina to be unintelligible at times, and her kindergarten teacher, also reported the same thing. But her governess was saying that she didn't have any trouble understanding Christina. But if Christina is at home most of the time with the governess, then it would be likely that the governess would understand her because she's with Christina all the time. So it's good to know that those processes are what's making her unintelligible to other people. So thank you. Do you know where we need to go forward from this, Ellie?
So to address Christina's mild to moderate articulation and phonological impairment, we have developed a long-term goal. That is, Christina will be able to correctly produce all age-appropriate sounds at the sentence level with 90% accuracy, and this is just to increase her intelligibility within the 6-month approval period that we have. So within that long-term goal, we've also created 3 short-term goals to address over time. So the first one being that Christina will be able to correctly produce all age-appropriate sounds in isolation with 90% accuracy. Second, Christina will be able to correctly produce all age-appropriate sounds at the word level with 90% accuracy. And then lastly, Christina will be able to correctly produce all age-appropriate sounds in all positions at the sentence level with 90% accuracy.
Okay, that sounds good. Haley, do you have anything to add with the audiological evaluation for Christina?
So for Christina's audiological evaluation, the pure tone average threshold for 1,000, 2,000, 3,000 hertz was 25 decibels hearing loss, and that is pretty high for her age because for her age, around 10 to 15 decibel hearing loss is considered normal. So she should have a full audiological evaluation, and also when her hearing was assessed for the first time by Dr. Dangerlow, her results were inconclusive.
Okay. So I wanted to ask each of you about her behavior during your evaluation. I know that Miss Smith had told me that Christina enjoys swimming and playing board games and playing with her pony, but she has trouble turn taking and playing with others. However, I don't really think that's a big deal because Christina is 5 years old. Like 5-year-olds are always gonna have trouble playing with other people, and that's a skill maybe for later development, I was thinking. But I just wanted to hear if you had any troubles with Christina during your evaluations. Did you have trouble, Casey?
No, she was very compliant, but it is important to take into consideration that we are adults working with her and we're not children playing with her, so the structure may have impacted the interaction.
Okay, and you, Haley? Did Christina have any behavioral problems when you were?
Not with me. She behaved fine with me.
Okay, so why don't you each write up your evaluation reports and then send them to me, and then I can go to Christina's mom, Miss Smith, and we can just discuss it. I wanted to talk about how maybe Christina is being immersed into the Native American culture because her ethnicity is Native American, and even though she was adopted, we don't know if Miss Smith is immersing her in that culture. And so, just to be careful and to be considerate, I know that you had done some research, Ellie, on the Native American culture, and I was hoping that you could share it with the rest of the group.
Well, if Christina is being immersed into the Native American culture, we really need to be smart about our approach to therapy in order to get the most out of it, because a lot of Native American families have a history of being forced into boarding schools, and because of that, they may be distrustful of the school system.
Okay.
So we really need to take time to build up and establish trust with them in order to get the most out of therapy. With that being said, Native American students typically respond really well to professionals making an effort to really make strong personal relationships with them. Adding on to that, Native American families typically view rehabilitation as very family-centered. So with our therapy, we need to be very proactive at involving the entire family. So her brothers, her mom, and even the governess.
Okay, so that would have implications for you as speech language pathologists. So are you guys planning to go into their home, or?
We are going to begin therapy just primarily at school and just assess how she is progressing and address it from there.
Okay, sounds good. So I was thinking that maybe moving forward, I would talk with each of you and send home assignments with the governess every week to practice the skills that you have learned and that she's learned in therapy with you guys. And maybe when they get home, she can do it with her brothers and like incorporate the family with the take-home assignments that Christina will perform, and hopefully she will improve. So I just thank you everybody for coming here today and just discussing Christina. So next week we can meet again and reevaluate where Christina's at.
Okay.
Thank you.
Thank you.